latest updates on the COVID-19 response. Here is Undersecretary Maria Rosario Vergere. Good morning, Yusek.
Magandang umaga, Lindsay, and of course, good morning to Yusek Eric Domingo. Magandang umaga po sa inyong lahat. Happy Friday. Mariin namin pong pinapaalala na ligtas po ang ating mga bakuna. Masusing pinag-aralan po ito ng ating mga eksperto sa Vaccine Experts Panel ng Department of Science and Technology at mga eksperto po ng ating Food and Drug Administration. Pati na rin po ang mga miyembro ng ating National Immunization Technical Advisory Group. Ang mga bakuna na po ito, bago po ito naaprubahan, ito po ay dumaan sa masusing pag-aaral ng lahat ng ating mga eksperto para masiguro po natin na ito po ay magiging ligtas para sa ating mga kababayan at lalong-lalo na ito ay magiging epektibo na labanan ng COVID-19. Patuloy pong binabantayan ng DOH, ng FDA at saka ng ating vaccine cluster at ng mga eksperto. Kasama na rin po ang ating National Adverse Events Following Immunization Committee or NAFIC, ang mga resulta ng pagbabakuna sa ating bansa at sa ibang bansa. Napakarami na po ng ebidensya mula sa isinasagawang pagbabakuna laban sa COVID-19 sa iba't ibang panig ng mundo na epektibo at nakakatulong po ang bakuna sa pagbababa po ng mga kaso at nauuspital at namamatay dahil sa COVID-19. Sinusuportahan po natin at sinusuportahan po ng ating mga eksperto at siyensya at medisina ang lahat ng desisyon na ginagawa po ng ating gobyerno. Pinapaalala rin po namin sa lahat ng ating kababayan na maging maingat at responsable po tayo sa mga impormasyong binabahagi natin sa ating kapwa. At siguraduhin po natin na hindi po ito magiging sanhi ng pagkapahamak sa ibang tao. Milyong-milyong tao na po ang naililigtas ng bakuna mula sa mga sakit tulad ng tigdas, polio, hepatitis, flu at iba pa hong mga sakit na maaring maagapan dahil sa pagbabakuna. Makakasama po natin ngayong umagang ito si FDA Director General Yusek Eric Domingo para magbigay po siya ng ilang updates tungkol sa adverse events following immunization ng COVID-19 vaccines at saka yung regulations po ng FDA para sa ating medical grade oxygen. But first, please allow me to proceed with some updates on our national COVID-19 situation and our biosurveillance efforts. As of August 12, 2021, the total reported confirmed cases is 1,700,363, of which 5.16% are active cases, 93.11% are recoveries, and 1.74% are deaths. Looking more closely at our active cases, 97.59% of these are either asymptomatic, mild, or moderate cases. 2.41% or 2,109 cases are severe or critical. The top 5 regions contributing to these new cases being reported are the National Capital Region, Region 4A, Region 3, Region 7, and Region 6. And the top 5 areas contributing to these new cases are Cavite, Bulacan, Quezon City, Laguna, and Manila. Now, given our epidemic curve, we are seeing now a new peak every week. The latest peak is at the first week of August. Looking at the contribution of each region to these cases, the National Capital Region with the dark blue bars, Region 3 with the yellow bars, Region 4A with the teal bars, and Region 7 with the orange bars showing increase. National cases saw an increase in the recent week. Cases from August 5 to August 12 recorded 10,459 cases per day, an increase of 2,472 cases or 31% compared to the previous week's 7,987 cases. Disaggregating our epidemic curve into the major island groups and the NCR plus areas, we have noted that all areas are showing an increase in cases. NCR and NCR plus areas are showing a steep increase. The rest of Luzon, Visayas, and Mindanao exhibiting slight increase in the number of cases. Nationally, we are at high-risk classification with a positive 2-week growth rate at 60% and a high-risk average daily attack rate, which increased to 8.37 cases for every 100,000 population. We would like to flag the National Capital Region, Region 7, 10, 4A, Region 1, 3, 2, CAR, and 6 with high-risk case classification based on its moderate risk 2-week growth rate and high-risk average daily attack rate. Apart from these high-risk areas, 4 other regions with positive 2-week growth rates, which are regions 12, 9, 5, and BARM. Local Delta cases had been detected in 13 out of our 17 regions as of the last run done August 5. The National Capital Region maintains positive 2-week growth rate and a high-risk average daily attack rate and is currently at high-risk case classification. ADAR increased from 6.94 in the previous 3 to 4 weeks to 16.20 per 100,000 population in this recent week. In the National Capital Region, the 7-day moving average shows continuous increasing trend as cases in the recent 7 days have exceeded the previous 7 days by 933 cases. At the national level, deaths have declined since June of this year. However, there is a slight increase in deaths in the last week of July. That is the third to the last bar. With the incoming deaths report, this number is still expected to increase. Evident here as well is the increase in deaths in Region 3, which are the violet bars, and Region 7, which are the orange bars. Their contribution to the total number of deaths is seen to be increasing in the past week. Significant increase in deaths is noted as daily average deaths had been continuous in the past days. Daily averages is now at 52 deaths per day. All the areas in the National Capital Region have a positive 2-week growth rate. Navotas and Pateros are at critical risk case classification, having both their 2-week growth rate and average daily attack rate at high risk. Total COVID-19 beds and ICU bed utilization of Pateros already at 100%, Navotas with 100% bed utilization. Aside from these areas, 7 other cities with high-risk health capacity. With regional health capacity, it remains to be at moderate risk utilization, less than 70%, but Districts 2 and Districts 4 at health capacity greater than 70%. 17 out of 17 cities in NCR are with Delta variant cases as of the latest run, which was August 5. Of the 17 cities in NCR, 11 are currently classified as Alert Level 4. These are Navotas, Malabon, Valenzuela, Pateros, Marikina, Taguig, Quezon City, Makati, San Juan, Muntinlupa, and Las Piñas. This table shows the classification of all areas into their corresponding alert levels. Areas highlighted in pink have detected Delta variant cases in their localities. Aurora is now at alert level 3. The provinces of Nueva Vizcaya, Zamboanga Sibugay, Misamis Occidental, and Surigao del Sur escalated from level 2 to level 3. For areas under level 3, the action points are granular lockdowns, active case finding, target decongesting hospitals with mild and asymptomatic cases, and start increasing hospital beds. Healthcare capacity issues must not be only addressed on the LGU level, but also at the regional and national level. The following areas escalated from alert level 2, Zambales and Guimaras. The following areas escalated from level 3, Antique, Bohol, Zamboanga del Sur, Cotabato, North Cotabato. For areas under alert level 4, the action points are granular lockdowns, active case finding, expansion and increasing of beds, oxygen needs should be available, severe and critical must be immediately and properly referred, and there should be assurance of accessibility of PhilHealth benefits for COVID-19 patients. Healthcare capacity issues not only to be addressed at the local level, but also at the regional and national levels. Now let us go to the biosurveillance updates. Of the 9,379 sample sequence assigned with a lineage as of August 11, 25.8% were positive for the beta variant, 23.4% were positive for the alpha variant, and 6.69% or 627 samples were positive for the delta variant. and 0.02% or 2 samples positive for the Gamma variant. Among the 627 Delta variant cases in our country, 597 have recovered, 13 have died, while 13 remain active after validation and repeat RT-PCR conducted by our local epidemiology and surveillance units. The outcome of 4 cases are still being verified. 73 cases are returning overseas Filipinos, 505 are local cases, while 49 are still to be verified. 53% or 337 are males, and cases belong to age group less than 1 year old to 84 years old. As for the vaccination status, 40 cases received 2 doses of COVID-19 vaccine, 18 cases received 1 dose, while 91 cases were not vaccinated, and the vaccination status of the rest are still being verified. Among the 177 newly detected Delta variant cases in our country, 173 have recovered, 1 has died, while 3 cases are still being verified. 3 cases are returning overseas Filipino workers, 149 are local cases, while 25 cases are still to be verified if local or returning overseas Filipino. 50% or 89 are males, and cases belong to age group less than 1 to 83 years old. As for the vaccination status, all of these are still being verified as of this time. So this slide summarizes our key activities for our week 2 of the Crisis Action Plan that the government is undertaking in light of the variants of concern. We are augmenting support in critical areas by increasing bed capacity to include tents as part of our accordion policy in critical hospitals. So just 2 days ago, we have witnessed the turnover of the modular hospital of the Lung Center of the Philippines. Southern Philippines Medical Center's modular hospital will also be completed soon. For Central Luzon, 3 modular extension hospitals are underway. We are augmenting support further by monitoring emergency room waiting times. Metrics for emergency room occupancy and waiting monitoring will be part of the information that the One Hospital Command Center will gather to better enhance patient experience and improve triaging. We are moving asymptomatic and mild COVID-19 cases from hospitals to temporary treatment and monitoring facilities for us to decongest and maximize our capacities. We are enforcing mobility restrictions. In order to do this, we are ensuring there is adequate SAP distribution. So last August 11, the special assistance to individuals in crisis situations was provided to 312,240 families, amounting to more than 1.2 billion pesos in the cities of Iloilo, CDO, and Gingoog. In NCR, the payout for SAP has started already. We are also securing international borders while ramping up our repatriation efforts. We are monitoring repatriation flights from restricted countries, and for special commercial flights also, we are also monitoring. We monitor interzonal checkpoints and APORs. Finally, we are scaling up our community efforts through active case finding, targeted and assisted vaccination. As of yesterday, there were no vaccination sites that have reduced capacity in terms of manpower and excursion in the cold chain supply. Expand vaccine eligibility for specific groups as endorsed by the Vaccine All Experts Group. And finally, to combat the anticipated rise in cases, we all highlight the 3 action points that we must sustain and further improve in the weeks and months to come. First, do active case finding and immediate isolation. Second, we need to hammer early and fast by proactively implementing stricter measures of the health protocols. And finally, very important, we wish to reiterate that regardless of any variant which may be in our country, minimum public health standards and vaccines work. Thank you, Lindsay, and over to you.
Thank you very much po, Yusek, for your updates. And now, may I again call on our Director General of the Food and Drug Administration to provide us with updates on the adverse events following immunization of COVID-19 vaccines and FDA regulations for medical-grade oxygen. Magandang umaga po, DJ Eric.
Hi, good morning, Lindsay. Good morning, everybody. And of course, good morning to my dear friend, Yusek Rosette. Nice to see you again. Sa mga kaibigan natin sa media, dalawa yung assignment na binigay ni Yusek Rosette sa akin today. No? Number one, to update everybody on our surveillance ng COVID cases sa mga tao na nabakunahan na dahil ang dami na rin naman nating nabakunahan ngayon. So I will update you on the surveillance reports that we've been getting sa FDA through VigiFlow on the cases of COVID that we've been getting. And then second would be yung sa status ng oxygen regulation natin dito sa Pilipinas ngayon because this is also regulated by FDA. So let me share my screen. Nakita ko medyo marami-rami ng tanong dun sa chat box. No? Hopefully, a lot of them will be addressed already with this presentation. Okay, so as of now, 8 pa rin yung ating meron tayong emergency use authorization na vaccines. Minsan siguro nako-confuse yung iba kasi parang more than 8 yung naririnig nyo na pangalan. It's because a lot of the vaccines actually have different names. Pag natin halimbawa sa Europe or sa US or sa ibang mga lugar. For example, yung Pfizer sa Europe Comirnaty ang pangalan niya. So nagbibigay din tayo ng EUA separately pag may ibang brand name siya although it is the identical product. For example, sa US FDA, ang pangalan niya ay Tozinameran and we've accepted also AstraZeneca, Pfizer donations for example from US. So we give separate the FDA gives separate EUAs every time meron tayong bagong binili or bago tayong tinanggap na donation kasi we have to double check kung talagang these are manufactured under good manufacturing practice, kung yung equivalent talaga, pareho talaga yung laman niya na bakuna, at kung yung pong kanyang production chain ay talagang sigurado tayo na guaranteed ang quality. Yung AstraZeneca, minsan maririnig nyo rin yan sa pangalan na Vaxzevria, at kung meron din tong parang generic counterpart sa India, yung Covishield. No? Coronavac is of course the same as Sinovac, yung Sputnik V, Janssen, Covaxin, Moderna, and then recently yung Sinopharm which we gave an EUA to DOH to accept donations from China as Sinopharm. Pero recently nakatanggap din siya ng the equivalent, same vaccine, kaya lang pagdating sa UAE, ang pangalan naman niya ay HyatVax. So it's the same vaccine din, no? Yung Sinopharm at saka yung HyatVax. These are identical vaccines, magkaiba lamang yung brand names. So at this time, ito pa rin yung mga may EUA sa atin na vaccine. The total doses, this is my report covers only until August 1, no? 2021 kasi ito yung alam niyo naman hindi naman mabilis na mag-update tayo ng ating data. 2 weeks ago ito, we have delivered 31.5 million doses, almost 31.6, and administered 20,863,000 as of August 1. And yung number of individuals that are partly vaccinated or yung nakatanggap pa lamang ng 1 vaccine of a 2-dose regimen was 11.7 million at that time. At yung number of people fully vaccinated is 9.1 million noong August 1. Now, most of our vaccines, if you look at the distribution right now, ang pinakamaraming number ng vaccinated would be the A3 group, individuals with comorbidity. Sinusundan lamang ng ating mga senior citizen. Ito yung talagang hinahabol natin, no? At talagang ito yung medyo hindi pa natin complete ang coverage ng ating mga senior citizens, followed by yung ating A4 group, and then the health workers. Yung frontline health workers natin, we're also trying to catch up to make sure na mabakunahan din sila lahat. But this is a big majority of our health workers already. So like I said, partly vaccinated, 11.7 million by August 1, and fully vaccinated, 9.1 million. So marami na, no? Parang mga 10% na ito ng population ng Pilipinas. Isa sa bawat 10 Pilipino ay nabakunahan na at medyo maganda na rin mag-compare kasi iba pa rin yung nagko-compare ka for example sa 108 million tapos i-compare mo sa 1 million lamang na bakunahan, mas maganda na yung nakikita natin ng mga patterns kapag ang 108 million ay kino-compare mo na sa 11 million kasi 10% na yon ng ating population. So pinaka-nauna natin ginamit is Sinovac followed by Astra, and then Sputnik, Pfizer, Moderna, and Janssen. And these reports come from VigiFlow. So yung report ng FDA na nakikita namin everyday, yun yung pinapasok doon sa online system natin ng VigiFlow. Of course, meron pa sigurong mga report na hindi pa na ipapasok sa VigiFlow, na na-update pa rin yan continuously. And of course, kung meron pa rin mga health workers o mga pasyente na hindi pa rin po sila nagre-report sa kanilang vaccination center at meron silang alam na adverse event na hindi nila na i-report, we ask everybody na to please report to your vaccination site para maipasok po sa VigiFlow. Kasi very important yung surveillance natin para makita talaga natin kung ano ang nangyayari, tsaka kung ano ang pattern ng cases natin especially when it comes to COVID. So this one is AEFI reporting particularly to COVID. Less than 1% of Filipinos have been vaccinated report some form of adverse event, and great majority of those are mild. Yung mga nagkaka-COVID naman, binabantayan din natin. So isa-isahin po natin. Sa Sinovac, meron na tayong 7 million fully vaccinated, 5 million partially vaccinated. Meron tayong mga nagka-COVID between the first dose and the second dose, bago siya nagka-second dose. Meron po dun sa dito sa 5 million na ito dun sa 7 million na yon na at least one vaccination, meron 266 na nagkaroon ng COVID bago na natanggap yung second dose. And unfortunately, doon sa 266 na yon, in fact, there were 39 who died from COVID. No? Hindi po yung bakuna ang nagkukos ng COVID, para lang iklaro, because the vaccine that we use are inactivated viral vaccines, viral vector, or mRNA vaccines. Hindi sila nakakakos ng COVID. Pero ang sinasabi nga natin, habang hindi ka pa fully protected, talagang maaari ka pang magka-COVID. And in case of Sinovac, out of 7 million, may 266 na nagka-COVID before the second dose, 39 of those died from COVID. After the second dose, pero hindi pa po umaabot ng 14 days, no? Merong 38 na itala sa ating VigiFlow system na nagka-COVID at meron din pong 2 namatay from COVID doon sa mga pasyente na iyon. At after 14 days, ito po yung considered na natin na fully vaccinated, no? 14 days after the second dose. Out of 5 million that have been vaccinated completely with 2 doses at lumagpas ng 14 days, mayroon pong 91 nagkaroon ng COVID. At meron pong isang namatay doon sa mga pasyente na iyon. At meron pa tayong 11 cases na hindi natin sigurado pa kung complete or incomplete yung number of doses nila, pero nagka-COVID sila kahit nakatanggap po sila ng Sinovac. So parang ganun din po yung sa AstraZeneca natin, 3 million ang partially vaccinated. Between first and second dose, 255 cases pa ang nakita natin na nagka ng COVID, and 21 of those died from COVID. Doon naman po sa mga complete na ng second dose, merong 13 na nagkaroon pa ng COVID pero mild lahat at wala na pong namatay. Doon naman sa after the second dose, 2 weeks after the second dose, meron pang 24 na nagka-COVID pero mild din lahat at wala pong namatay. Sa Sputnik, ito konti pa lang naman kasi 249,000 pa lang yung na-vaccinate natin dito. So meron lamang 6 na nakitang nagka-COVID between the first and second dose. Ang Pfizer, naka-million na rin tayo nito, 1 million mahigit na rin ang nabakunahan. Merong 18 na nagka-COVID between the first and second dose at may isang nagkaroon ng COVID after, 2 weeks after, more than 2 weeks after the second dose. But mild din naman at hindi po namatay. Pero meron tayong isang hindi tayo pa sure, pinapacheck pa natin kung kailan yung bakuna niya na namatay from COVID kahit nakatanggap po ng Pfizer vaccine, yung sa dugo. Yung Moderna, ito konti pa rin naman, 76,000 pa lang na bakunahan natin ito with at least 1 dose. And so far, we've had 1 case of between the first and second dose na nagkaroon ng COVID. So kung makikita naman ninyo, syempre habang dumadami po ang ating nababakunahan, mas lumalaki rin naman kasi yung ating denominator, no? At para pare-pareho naman ang ang pattern sa lahat ng cases. Between the first and second dose, we still get a small percentage of cases na nagkakaroon ng COVID. This drastically drops after the second dose and especially after 2 weeks after the second dose. Talagang pababa po ng pababa. At yun nga, pababa rin ng pababa ang possibility or probability na ang isang tao ay mamatay from COVID. So kung titingnan natin, out of these 11 million people, after the first vaccine, we had 546 cases and 61 fatalities from COVID na nai-report sa VigiFlow. After the second dose, we've had 51 cases and 2 mortalities. more than 14 days after the second dose, 116 cases and 1 fatality ng fully vaccinated. Yung unknown po natin, 22 with 1 fatality from COVID. So ang total natin sa 735 ang nagka-COVID at 65 yung mga fatality from COVID. Now we have to put this into perspective. Itong 735 at saka 65 nito, out of 11 million ito na nabakunahan natin for the past 6 months. No? 10% ito ng populasyon ng Pilipinas na nabakunahan natin for the past 6 months. When it comes to vaccine breakthrough infection, ang detection, ito yung tatawag natin kapag nagkaroon ka ng COVID more than 14 days after completion of all doses. And meron tayong, as of August 1, ito yung mga report natin, 116 cases of breakthrough infection, and most of them, 88% were mild or asymptomatic, may 11% na na-hospitalized, at may isang death tayo out of these breakthrough infections. So kung bibilangin natin ang percentage nito, this is less than 1/1000 of a percent. No? This is 0.0013% out of 9.1 million fully vaccinated individuals, and smaller pa kung titingnan natin yung 11.7 million natin na at least partially vaccinated. Napakaliit na porsyento, especially considering na ngayon for every 100,000 Filipinos, merong 6 or 7 na nagkaka-COVID araw-araw na nadidetect natin. So kinumpira ko to, no? Kung titingnan po natin yung COVID-19 bulletin natin nung date ng August 2, ang active ito yung cases natin as of August 1. As of August 1, we had total cases of 1.597 million. No? At saka ang death natin ay 28,000 deaths. Ibig po sabihin, 18 months yun. Simula nung February, March tayo nagkaroon ng mga first cases ng 2020. So kung in the 18 months na nagsa-surveillance tayo, bawat buwan nakakakita tayo ng 88,760 cases. No? At 1,556 deaths per month. So kung ikukumpara naman po natin ito dito sa 10% ng population natin, 11 million na nabakunahan, na in the last 6 months na itong mga binabantayan natin sila, nagkaroon tayo ng 735 reported cases of COVID and 65 deaths. Alam naman po natin, meron pa sigurong mga pahabol dyan na mga hindi na-report. Pero kahit naman i-report natin yan, kahit i-times 10 natin yan, yung 735, nagiging 7,000 po yun. No? Yung 650, nagiging 65, yan siguro konti na lang naman ang itataas dyan kung meron pang hindi na-report. No? So kung i-compare natin siya sa ganito, kahit gawin natin 10% lang, ang 10% ng 88,760 ay 8,760 cases. And ang 10% ng 1,556 deaths per month is 156 deaths per month. So makikita naman po natin yung pattern. No? Although of course yung talagang pag-aaral nito ng effectiveness, ginagawa pa po yan ng Epidemiology Bureau ng Department of Health. Ito pinapakita ko lang para po makita natin yung pattern. And if you look at the general pattern, I think we can safely say that the benefit of vaccination outweighs the risk pagdating po sa pag-prevent ng COVID at pagka-prevent ng pagkamatay from COVID. The vaccines are effective and critical to control the pandemic. And ito po yung lagi natin sinasabi, talagang important to complete the recommended doses. Nakikita natin talagang meron pang mahigit na mabilis na pagbaba ng cases ng COVID at death from COVID kapag nakumpleto yung 2 doses. So ibig sabihin, kailangan kumpletuhin talaga yung 2 doses, and at the same time, especially between the first and second dose and the 14 days after, kailangan talaga observe the health protocols very, very strictly. Kasi talaga kung pwede pa rin talaga tayong mahawa ng COVID. And breakthrough infection cases, of course, occur, but they are in a small percentage of fully vaccinated individuals. And the vast majority are mild to moderate cases. No? Wala naman talagang 100% na efficacy na vaccine. Pero nakikita naman po natin napakalaki ng percentage ng efficacy, effectiveness niya sa mga binabantayan natin mga pasyente. And then just a short update for everybody sa medical grade oxygen. No? Para lang malaman na lahat, ang medical grade oxygen is classified as a drug para po siyang gamot. No? Kasi kailangan po ito pure kailangan po ito talagang 99% ang laman niya at wala siyang mga halo na maaari pong magdulot ng sakit sa tao, no? Ang medical gases refer to any gas or mixture intended as an anesthetic, therapeutic, for diagnostic or prophylactic purposes. So maraming pong iba-ibang klase ng medical gas katulad ng ginagamit sa anesthesia, mga ginagamit po sa mga makina sa ospital, pero isang pinaka-common pa rin yung oxygen. So ang number one po talaga natin na medical gas na nila-license ng FDA ay yung oxygen. At yung pong pressurized na tangke kung saan siya nakalagay, parang yun po yung binibilang natin na kanyang packaging niya na ina-approve din po at nire-regulate din po ng FDA. So ang FDA po nire-regulate unang-una ang mga manufacturers ng medical gas. Kumukuha po yan sa atin ng license to operate para po sila ay makapaggawa ng medical gas at maaari po nila itong ibenta sa mga health facilities. Meron din po mga health facilities or ospital na sila mismo gumagawa ng oxygen para doon sa kanilang use nila sa kanilang ospital at minsan nagsusupply din sa maliliit na mga ospital sa katabi nila. At pagkatapos po nilang kumuha ng license to operate, nire-rehistro din po nila yung product nila na medical oxygen. So meron din pong CPR or Certificate of Product Registration ang medical oxygen. And it is classified as a prescription drug. Kailangan din po yan ng reseta bago gamitin. Hindi naman po yan basta-basta na lang natin gagamitin dahil may toxicity rin po ang medical oxygen. So as of now, simula po last month pa to talagang pinaghandaan naman natin at minadali rin po ng FDA ang pag-process ng mga applications ng mga manufacturers for medical oxygen. And we have 81 licensed manufacturers all over the country. Luzon, Visayas, Mindanao po yan, nakakalat ang kanilang mga manufacturing plants. Pagkatapos po, meron din tayong 30 additional na ospital na nagge-generate ng sarili nilang oxygen na license din po ng FDA sa Luzon, Visayas at Mindanao. At so far, wala pa naman po tayong nararamdaman na shortage. Dahil sa pagtataya po ng Department of Trade, wala pa naman po 50% ng mga manufacturing capability ng ating oxygen plants ang nagagamit ngayon at kinakailangan ng ating mga ospital. So kaya pa naman po natin yan. At gusto lang namin paalala, naglabas po kami ng advisory sa lahat, wag naman po yung mag-hoarding or magtatago ng mga tangke-tangke ng oxygen sa bahay. Unang-una, ay hindi naman po tama yon dahil baka mayroong mga ilangan iba. Pangalawa, hindi po yun po pwede. No? Kasi unang-una, the sale of medical grade oxygen requires the prescription of a licensed physician. So pinakikiusapan po natin ng mga doktor, magre-reseta lamang ng oxygen kung talagang kinakailangan ng pasyente, no? Lalo na yung mga for home care. Otherwise, kung for standby purposes lang, hindi naman po yan tama. Use of oxygen therapy without guidance from your health professional may lead to irreversible health damages. Meron pong toxicity ang oxygen, no? At pwedeng ma-injure actually ang ating baga pag gumagamit tayo ng high concentration oxygen or ng pure oxygen nang hindi tama ang pagkakagamit nito. At ang isa pa rin pong napaka-importante, ang oxygen po ay talagang highly combustible and flammable. Pwede po talagang sumabog yan. Lalo na kapag nakatago sa isang high pressure tank. Daig po niya ng LPG, no? Mas malakas po ito. And they may cause explosion and environmental hazards that may lead to emergency and safety issues at home. So hindi po talaga tayo dapat nagtatago ng oxygen tank sa bahay. In fact, ang mga ospital po, bago natin lisensyahan ng DOH yan, chine-check natin kung meron talagang safety precaution sa pag-handle ng oxygen, kung nakalagay sa tamang lugar, kung nagkaroon ng earthquake, kung hindi yan basta mahuhulog, may pantali ba yan, meron bang yan. Kasi napaka-delikado po ng oxygen, lalo na kung iiwan natin sa bahay. So maraming salamat po, and if you have any questions, I'll be very happy naman to answer.
Thank you for your updates, DG. I will now be going through the questions po sent by our media partners sa ating Zoom chat. So for the question po of Patricia Denise Chu and Greg Gregorio, DG, if you could clarify daw po, ano daw po yung mga dahilan kung bakit may nagkaka-COVID even after inoculation po ng vaccine. So may mga reports din po na may mga reinfections na nag-progress to severe and critical cases. For example, among first batch of healthcare workers inoculated nung nauna po. So, ano daw po yung reason kung bakit even after inoculation or vaccination ay may risk pa po of contracting the COVID?
Oo. So like we said, wala naman talagang 100% no, na efficacy na vaccine. It really depends on each and every person. Hindi tayo kasi lahat pare-pareho din ang level ng reaction natin sa bakuna at yung level na immunogenicity na na-generate ng ating katawan. So may mga ibang tao na kahit nabakunahan na, hindi pa siguro sapat iyon no, para kontrahin yung viral load kapag dumating siya, kaya nagkakaroon pa rin ng breakthrough infections. However, siguro kaya siya nagiging mas mild dahil kahit paano meron ka pa ring antibodies at saka meron ka pa ring resistance na nag-generate. Yun ang nakikita natin. Kaya merong mild, karamihan sa kanila mild pa rin ang cases. But wala talagang vaccine na 100% ang efficacy and there will always be breakthrough cases. Kahit ano pong bakuna, at hindi lang po kahit sa bakuna sa sakit sa COVID, kundi sa lahat po ng bakuna, sa lahat ng sakit. Ganun po talaga.
DG, if you could clarify lang daw po kasi baka daw ma-misinterpret na maraming nagkaka-COVID because of a specific vaccine. Based on dun sa report nyo kanina, DG, how can we report this appropriately and properly po sa public, yung reinfection po of certain brand of vaccines?
Well, you have to check yung percentage, no? Kasi hindi rin naman pare-pareho ang number ng nabakunahan natin kung nakita niyo, no? Kaya naman pinakamarami tayong nare-report din na na-observe from the vaccinees ng Sinovac and AstraZeneca kasi sila naman talaga yung pinakamaraming nating nagamit na vaccine at this time. So as a matter of percentage of the people who are getting COVID infection from compared to other vaccines, kailangan tingnan natin siya sa percentage of the total number of vaccinated people.
Thank you very much po, DG. DG, if you have a response here po, ano daw po ang implication kapag nag-vaccine hopping ang isang tao and may mga fully vaccinated daw po kasi na nagpapabakuna ulit sa ibang lugar?
Yeah, nakita ko nga yung tanong ni Kalin dyan, tsaka kung meron daw silang pananagutan sa batas. Actually, hindi naman illegal, hindi naman natin sila kukulihin ng pulis dahil nagpabakuna ka. It's less of a legal but more of an ethical and moral obligation. Tandaan po natin, kapag nagpabakuna tayo, tapos kumuha pa tayo ng bakuna na isang set pa, may kababayan tayo na nade-deprive of the vaccine. Sa health walang masyadong wala tayong nakikita na masyadong problema, especially kung magkakalayo naman yung vaccines, no? Kaya lang, yun nga lang po, talagang ang mali naman doon, meron po kasing tao na hindi makakatanggap ng bakuna dahil tayo nag-swabang at nagpabakuna tayo ng higit sa dapat nating tanggapin.
Thank you po, DG. For the next question po from Caroline again, bakit daw po namatay yung isang fully vaccinated individual?
It was really COVID, no? It was a very elderly male. Hindi ko pa nakita yung details, pero talagang COVID, and the patient died from COVID-19. So like I said, talagang wala naman tayong 100% na efficacy, pero when you have naman one person fully vaccinated or two or three, di ba? And then you look at the 11 million that have been vaccinated, then we see that there is an almost 100% efficacy in the prevention of death. But there will always be breakthrough infections, and unfortunately, meron pa rin po talaga na mamamatay from COVID-19.
Thank you po, Yusek. Sabi po ng ilang mga anti-vax and pro-ivermectin lobby group ay hindi raw transparent ang pagre-report ng data ng FDA sa AFI. Ano daw po yung masasabi niyo po dito?
Ang FDA po every week naglalabas po kami ng bulletin at saka ng pong update on the AEFI. It is fully transparent and it's nandun po siya sa FDA website, no. So yun pong nire-report namin ay kung ano rin ang natatanggap namin na report through VigiFlow. But of course, continuous naman po natin binabantayan niya ng FDA at saka ng Epidemiology Bureau. Tapos yun po ating mga adverse events following immunization committees. At lahat naman po ng importanteng detalye ay ibinibigay po natin sa publiko.
Thank you, Yusek. Yusek, may clarification lang din po on how you came up with the reports po of comparing yung mga ilan na yung nagkaroon ng reinfection after the first dose or sa second dose, and how are you making the comparisons daw po sa data po ng FDA?
Oo, so ito yung pagde-report siya sa FDA and then we ask for data. Kailan ba kung nabakunahan, kung kailan ba nakabakunahan at saka kung kailan nagkasakit. So yung pag-report namin na iyon, it's direct reporting of the data that we have. Wala naman pong pin-process doon. Kundi dino-double check lang namin yung kanilang vaccines na natanggap at kung kailan nila natanggap.
Yusek, kung if ever may details lang po kayo regarding this, they would like to clarify kung yung namatay daw po ba is due to the Delta variant, and if you have data na po on the breakthrough infections na breakthrough infections na cases infected ng Delta or carriers po ng Delta.
Wala pa tayong breakdown noon kung anong variant ng vaccine, kung anong variant ng virus yung tumama. Ito po I think this is something that we have to explain kami ni Yusek Rosette. Yun pong ating yung ating monitoring ng mga variants, hindi naman po lahat ng tao chine-check natin kung ano ang virus nila, kung anong variant nila, no. This is parang sampling lamang po ito. Kaya naman everyday ilang daan lamang naman ang pwede nating i-check, no. So para lang ito malaman natin kung ano na ba ang prevalent na variant ngayon na umiikot sa ating sa atin pong kapuluan, sa ating mga probinsya, halimbawa at sa mga syudad. Pero hindi naman po bawat isang tao ay i-check kung anong variant, at sa ngayon po hindi naman din natin hinihiwalay per variant kung ano yung mga cases, kung ano yung outcomes, at kung ano po yung naging effect ng bakuna sa kanila. It's really more of a surveillance of the population in general para lang po alam natin kung dumadami ba sila at kung ano po yung trend ng nagiging mas dominant na mga variants sa atin.
Thank you po, DG. DG, question po from Aiko. May certain liability po ba ang isang, for example, medical professional if ever they go against yung vaccination program of the government? And what measure are we doing po to counter yung mga ganong acts?
Well, kay Yusek Rosette na po yan, dahil ang FDA, pag nagbibigay po kami ng EUA sa DOH at sa mga kumpanya, nakasulat po doon that they have to strictly follow the guidelines set by the Department of Health. And of course, ang Department of Health lamang ang pwedeng mag-designate ng partners, ng vaccination partners. Hindi naman pwedeng kaliwat kanan nagbabakuna lahat. Ang pwede lamang magbakuna ay ang pinapayagan ng DOH, at kailangan sumunod po sila sa panintunan at saka sa implementation po na guidelines ng program ng Department of Health.
Thank you po, Yusek. From Red Mendoza, may estimated number po din ba tayo ng available oxygen supplies, and kakayanin daw po ba if ever there is a further case increase that will happen in the country or in NCR po? If you have the data lang, DG.
Well, yun pong pinakita ko kanina, we have 81 manufacturers that are licensed right now and 30 hospitals that are supplying oxygen to their own hospitals. At yun nga po ang estimate naman po ng Department of Trade dun sa volume ng capability na mag-produce ng medical oxygen ng mga ito ay hindi pa naman po tayo umaabot dun sa limit. Baka wala pa pong kalahati ng kanilang kayang i-manufacture ang kinakailangan ng mga ospital natin at this time.
Thank you po, DG. I think, DG, that's all the questions that we can accommodate for you now. Before you go po, meron po ba kayong mga final messages, of course, sa ating media partners and to all our viewers?
Opo, yun lang po ang gusto natin paalala. Tuloy-tuloy naman po ang ating surveillance, and we check. We of course check our COVID-19 cases and our breakthrough cases, and we know that we have them and that there will be more of them. Pero nakikita rin naman po natin na talagang the benefit outweighs the risk. The chance, the probability of getting COVID drastically decreases once you've completed your vaccination, and kasama na rin yun yung possibility of dying from COVID. So at this time, talaga pong mini-maintain natin that the benefit outweighs the risk and vaccination is still the way to go. And we ask everybody, either vaccinator kayo, to please report AEFIs para po talagang mas maganda at mas accurate po ang ating monitoring and surveillance. Salamat po.
DG, sorry. May mga pahabol pala tayo. Sorry po. Kung okay lang, DG.
Okay, sige.
From Mikhail DG, parang ano daw po yung circumstances behind the lone individual na namatay po even after getting fully vaccinated with Sinovac, and aren't vaccines supposed to prevent deaths po, and paano daw po tayo naka-arrive dun sa 0.0013% were all vaccinated individuals tested for COVID-19, and how many po of those actually tested for COVID-19 tested negative 2 weeks after the full dose?
Yeah, well, Miguel, I think we all know naman na hindi naman natin tinest lahat yung 9 million na nabakunahan natin. So yung sinasabi ko, yun lang 0.00013 dun sa mga na-report at natanggap ng FDA. Like I said, there could be underreporting, it could be more, but hindi naman siyempre magiging a lot more than that. All I can share with you is the data that we have. And for the case na nagkaroon ng COVID, it was really an elderly male who got COVID and died from COVID. So talaga pong walang pagkakaiba naman, no, na talagang nagkasakit siya ng COVID at namatay siya ng COVID.
Again, DG, maraming salamat po. If ever na lang po may mga follow-up questions po sila, and if may hindi po tayo nasagot na nahabol, we'll just send it to you po so we can provide additional responses. Yusek Reset.
Yes, thank you very much, Yusek Eric, and hopefully in the coming days we'll have you again here in our media forum to give updates to our media partners and the public. Salamat po.
Thank you, Yusek. Yusek, I will now be going through the questions naman po for us. From Job Manahan of ABS-CBN, to Yusek, what will DOH do regarding the supposed double vaccination of a netizen who, according to his photos on Facebook, got fully vaccinated by Sinovac in Mandaluyong in May and got another Moderna jab this week? This is considered booster shot po? Is this considered a booster shot po?
Well, since we have not officially recommended booster shots, so I will not classify this as a booster shot. Second, we are trying to get the details of this. We saw this in the social media platform, I think yesterday or the other day. So kinakausap po natin ngayon yung vaccination center. Pangatlo, katulad po ng sabi ni Yusek Eric kanina, actually wala naman ho talaga tayong legal, no, na parang sanction, no, for these individuals who are receiving these double vaccines, o yung pangalawa pa, no, aside from they were fully vaccinated already. But sana naiisip natin it's more of moral and ethical. Kung ano man po ang ibinakuna sa inyo, meron pong mga taong hindi nabakunahan dahil sa inyo. So lagi niyo pong iisipin yon na ang pakikipagkapwa-tao, lalong-lalo na ngayon dito sa panahon ng pandemya, ay napaka-importante po. So sana po lahat po tayong mga kababayan at tayo lahat na Pilipino, isipin po natin at magmalasakit po tayo sa kapakanan din ng iba. Kung tayo po ay fully vaccinated na ng isang bakuna, tayo po ay wag muna na pumunta sa direksyon na nagpapalagay uli ng panibagong bakuna. Kailangan po nating mabakunahan muna yung mga taong hindi pa nabibigyan ng bakuna para pare-pareho tayo may protection.
Thank you po, Yusek. And ano daw po yung policy ng DOH regarding instances like this? Will DOH monitor the possible side effects? And how can this be prevented in the future?
Yes, no? So kahit po na kayo po ay lumabag sa mga pamantayan at patakaran ng gobyerno, kami po ay may obligasyon pa rin na i-monitor kayo. Unang-una, kaya hindi pa ho talaga mairekomenda ang booster doses. Aside from equity, of course, as a major consideration, it's safety. Hindi pa po kumpleto ang ating mga datos ukol dyan, hindi pa ho kumpleto ang mga ebidensya na meron tayo sa ating mga eksperto. Kaya hindi pa ho yan nire-recommend ng ating gobyerno. Kaya kung sakasakali po na kayo ay magkakareaksyon dito po sa taong nagpabakuna ng doble, kayo po ay agad-agad na tumawag dun po sa ating vaccine site na pinagbakunahan nyo, o di kaya po kung meron hong malapit po na mga facilities sa inyo for health, maaari po kayo magpakonsulta. Huwag nyo hong patagalin sa bahay para po tayo ay maging sigurado.
Thank you po, Yusek. From Mads Villar, a man who died in Guinea is found to have Marburg disease virus. Sa tingin po ng DOH, may posibilidad ba na magkaroon rin ng ganitong pandemic katulad ng COVID-19?
Well, itong Marburg virus, nakukuha po ito sa mga fruit bats, no? And usually, ang mga fruit bats naman makita natin meron naman dito sa ating bansa. Pero ito pong sakit na ito has been nagkakaroon usually dito po sa parte ng mga African nations. No? So sana po hindi naman din tayo magkaroon, although ang sinasabi nga't nagwa-warn na ang ating mga eksperto globally not because na yung mahaba kasi incubation period ng Marburg disease is 3 weeks. So sabi nila by having that, mas malaki ang tsansa na magkalipat-lipat sa bawat tao because it can do human transmission at this is through secretions of humans, no? Parang yung Ebola. So nandyan po yung posibilidad, but of course we would like to guard again our borders and we would like to be very careful on this. Pero sa ngayon po, yung threat sa atin, yung risk ay napakababa.
Thank you po, Yusek. From Caroline and from Jerome, may clarification lang po regarding dun sa vaccination statistics natin. Yung nasa first dose po ba ay partially unvaccinated or nakakakuha na ng at least 1 dose? Paano daw po yung mga nakakakuha ng J&J na single dose? Diretso na po ba sila sa figures ng fully vaccinated?
Yes, kapag J&J, because it's a single dose, kapag binakunahan po sila, fully vaccinated na sila. As to those na first dose po ay partially vaccinated, hindi partially unvaccinated. So kapag naka-receive na po kayo ng isang dose ng kahit na anong bakunang meron tayo dito sa ating bansa, except J&J, you are partially vaccinated. Pero kapag J&J ang na-receive nyo, isang dose lang po yan, you are already fully vaccinated.
Thank you po, Yusek. From Red Mendoza, sa paglabas ng mga di umano ay experts na ang nagsasabi ay toxic daw po ang pagbabakuna na inaengganyo ng mga grupo na sumusuporta sa isang treatment. Ano po ang hakbang ng DOH sa mga grupong ito na nagpapakalat ng fake news tungkol sa bakuna and kailangan na bang humingi ng DOH ng karagdagang power para kasuhan ng mga taong ito na dinidikta na rin na huwag magpabakuna ang mga tao?
Unang-una lahat naman po tayo, no? Meron po tayong karapatan. There is freedom of expression in this country. Tayo naman po ay hindi mag-engage sa mga ganitong tao. Ang kailangan lang natin gawin ay palakasin natin ang ating information drive para i-oppose natin yung sinasabi nila. Alam po ng ating mga kababayan na ang bakuna po ay isang epektibong paraan para tayo po ay maproteksyonan laban sa COVID-19. At nakikita po natin yan dito sa ating bansa, hindi lang dito, ngunit sa buong mundo. So para po sa mga ganitong grupo, lalong-lalo na po sila naman ay galing sa health sector din, sana po ay pag-isipan natin maigi ang sinasabi natin dahil nakakaapekto po ito sa pananaw ng ating mga kapwa. Ngayong nandito tayo sa ganitong sitwasyon, mas maganda po na magkaisa tayo sa ating mga ibinibigay na mga paalala at abiso sa ating mga kababayan para po tayo ay maging ligtas, no? So ang ginagawa po ngayon ng Department of Health, amin pong kinakausap, no? We have warned the program already, no? Yung mga ganitong media na program, sana po nakikiusap kami na wag niyo na lang po sanang ma-engage ito po mga ganitong klasing mga balita dahil hindi po nakakatulong sa kumpiyansa sa pagbabakuna sa ating bansa. Tandaan niyo po ang ating pong sitwasyon ngayon ay napaka-critical, napakataas na po ng mga kaso, napakataas na ng utilization sa ating mga ospital at alam natin na ang pagbabakuna ay isang paraan para po mapigilan natin ito. So sana po sama-sama tayo lahat sa pagbibigay ng tamang impormasyon.
Thank you po, ma'am. Yusek from Lay Alvis, ano po ang mga paalala ng DOH sa mga fully vaccinated? And pakipaliwanag daw po kung paano pwede pa rin sila ma-infect at makapanghawa even after vaccination, lalo na daw po at may mga severe cases across younger age groups.
Yes, Lay, no? So gusto lang ho namin ipalala sa ating mga kababayan. Ang mga bakuna po na meron tayo ngayon, simulat sa pool naman, sinabi po natin na ang kanilang efficacy against symptomatic disease ay hindi po ganun kataas, no? Ibig sabihin, sinabi na natin nung umpisa pa lang, hindi po niya kayang i-block ang transmission totally. So, kaya po tayo nagkakaroon ng mga infection pa rin kahit bakunado na po tayo. Pero ang nakikita ho natin mga infection among vaccinated individuals, most of these infections are mild and asymptomatic, no? Ibig sabihin po kasi gumagana yung bakuna. Pero ang pinaka-importanting benepisyo po ng bakuna sa ating lahat is that it protects us from severe infections and therefore we are protected from being hospitalized and even dying. So yun po yung ating pinaka-importante na proteksyon na ibibigay sa atin ng mga bakuna ng COVID-19. So sa lahat po ng mga nabakunahan na, kaya ang tanging paalala lagi namin, kayo po ay susunod pa rin sa safety protocols. Hindi pa rin po tayo 100% ligtas. Maari pa rin po tayo magkasakit. At bagaman mild lang ang magiging sakit mo, pero pag uwi mo na hindi bakunado ang makatabi mo sa inyong bahay, sila po ay maari magkaroon ng severe infections. So napaka-importante po ngayon na isipin natin hindi lang ang ating sarili, pati na rin po ang ating mga kasama sa bahay, kapitbahay, at yung mga kasama sa komunidad.
Yusek, may mga report daw po na hindi pinapayagang magpabakuna ang mga buntis kahit lagpas na sa first trimester. Ano ang patakaran na sa mga pagbabakuna ng mga buntis?
Actually, Lay, mula nung nag-umpisa naman tayo ng pagbabakuna, nagkaroon na tayo ng patakaran sa mga buntis. At ang sabi nga ng ating mga eksperto noon, ang benepisyo outweighs the risk for pregnant women. Ibig sabihin, because benefits outweigh the risk, babakunahan natin sila. Nagkaroon lang po tayo ng provision noon dun sa ating previous protocol na ibibigay natin for the second and third trimester. Wag muna sa first trimester just to ensure safety. Ngayon, nagkaroon po uli ng pag-uusap at pag-aaral ang ating mga eksperto kasama ang Philippine Obstetrics and Gynecological Society. At sinabi po nila na base sa pag-aaral, yun pong tsansa na magkaroon ng reaksyon na adverse para sa mga first trimester pregnant ay maliit na maliit lang, pati yung epekto sa batang dinadala nila. So nire-recommenda po nila na magbigay na rin kahit sa first trimester. At ito po ay pinag-usapan sa ating mga all experts group kasama ang POGS, yung Obstetric Society. At napagkasunduan po na pwede na tayo magbigay sa first trimester of pregnancy pero kailangan ng medical clearance from their physician. Kailangan po na masiguro ng physician na ito'y magiging ligtas at walang ibang kalagayan, no, na hindi pwedeng magkakaroon ng contradiction do sa pagbibigay ng bakuna sa first trimester. So that is our recommendation from the all experts group. Binabalangkas na po ngayon yung guideline para dyan. Ngayon, para mabigyan po ng karampatang priority ang ating mga buntis. Dahil sinasabi nga po, ang ating mga buntis, they do not have any comorbids. Hindi po kinoconsider na sakit ang pagbubuntis. Pero, base sa ebidensya at siyensya, isa po sila dun sa mga taong ang immunity nila ay apektado rin because of the pregnancy that they have. Kaya po, ang ginawang desisyon ng ating all experts nirekomenda at pumayag naman ng vaccine cluster, isasama na po sila sa A3. Pero tatawagin natin expanded A3 kasi nga po ang buntis naman wala po silang sakit na itinuturing. Ito lamang po ay yung kalagayan o estado ng kanilang katawan dahil sa pagbubuntis. So we will be issuing out the needed guidelines for this para po mag-guide natin lahat ng vaccination centers at ma-prioritize po natin ang ating mga buntis dito po sa ating bansa.
Thank you po, Yusek from Barnaby Law. We are now halfway through the 2-week ECQ. Did it make a dent or is an extension necessary? If yes, why do you see the country now being able to avert an exponential outbreak, or will the projections of the 15,000, 42,000, and 58,000 daily active cases by end of September still hold? And from Caroline, ma'am, related question, will you recommend an extension of ECQ for NCR?
Yes, Barnaby, no? So yung question mo muna, kailangan natin maintindihan na yung ipinapakita po nating datos sa ngayon ay hindi pa ho ito yung datos na mararamdaman natin because we had ECQ. We have to go back to the incubation period of the virus and the different time periods ng mga nagkakasakit. So pag tinignan ho natin yung mga datos, maaring ito po ay from the week prior to the ECQ pa ho. Ito pong ating nararamdaman. So we will see the effects of this lockdown or ECQ maybe 2 to 3 weeks after this 2-week period of ECQ. So wala pa ho tayong pwedeng ibigay na conclusion regarding this 2 weeks implementation of stricter lockdowns. Ngayon, yun pong kung maaabot natin by the end of September, ito pong mga sinasabing mga projections ng ating mga eksperto, it will all depend on all of us. Ito pong pag-i-ease natin ng restrictions, ito pong pagtutuloy kung itutuloy ang ECQ o hindi, kung tayo po ay makakapagbukas na ng ibang sektor, kung bababa ang mga kaso at mga tao sa ospital, ay nagre-rely po iyan at depende yan sa lahat, sa atin lahat dito sa ating bansa. Magtulong-tulong po tayo. Tayo po ay magpatupad at mag-comply sa minimum safety protocols. Mag-mask tayo lagi. Alam niyo po, kamiting lang namin po ang mga governors no dito sa isang malaking lugar sa Pilipinas before I went in the media forum. And the regional PNP unit was giving this report na libo-libo pa rin ang kanilang nahuli dahil hindi naka-mask, hindi naka-face shield, nasa mga nagpukukumpul-kumpulan in crowded areas. So ito po ang isang bagay na pinapakiusap natin sa ating mga kababayan. Ang mga ospital po ay lagi na andyan. Ang gobyerno po, lagi po nandyan to support, to expand facilities. Pero kailangan gawin natin yung ating ganang atin na para maputol ang transmission sa komunidad, sumunod po tayo sa ating mga safety protocols para hindi na po further pa tumaas ang kaso, maputol ang transmission sa community, and therefore we can have less cases at hindi po dadating dyan sa sinasabing projection by the end of September.
Thank you po, Yusek. From Greg, one of the officials said last night that the government should temporarily suspend Data Privacy Act for positive cases para daw pwedeng i-announce ang pangalan nila and ma-identify ng mga tao for better contact tracing din daw po. What's your thoughts on this?
Tagal na pong pinagdedebatihan yan, simulat sa pool pa lang po ng ating pandemya noong 2020 March, no? At nung nag-umpisa nang pumalo ang mga kaso, marami po mga local governments were requesting that we suspend the implementation of this data privacy law. At ito po ay napag-usapan na rin sa IATF. At ito ang sinasabi nga, we need to uphold this kasi karapatan pang tao po yan, yung privacy na yan. So kailangan, ayon po sa batas, kolektahan lang kung ano ang necessary or importante na impormasyon and ibibigay lang sa proper authorities. Hindi kailangang ilatathala ang pangalan ng bawat tao sa inyong barangay. Maaari naman pong kausapin in privacy para po maibigay pa rin natin yung kanilang karapatang pangtao pagdating po sa mga ganitong sitwasyon.
Thank you po, Yusek. I will now be going through some questions po sent through our Zoom chat. From Aiko Miguel, meron daw pong mga ilang posts sa social media na nagkakaubusan ng mga gamot gaya ng paracetamol syrup at iba pang gamot na pambata. Can you confirm this po?
Hindi po yan totoo, no? So kailangan po natin maging mapanuri sa ating mga pinapalabas na impormasyon. Ito po ay magli-lead again sa panic para po sa mga kababayan natin. Tandaan po natin ang paracetamol, we have a lot of local suppliers here in the country. Raw materials also, meron po tayong local suppliers. So hindi po tayo mauubusan ng ganitong klaseng gamot sa ating mga butika. Maari lang po na nung nagpunta sila, hindi pa na-replenish ang mga stocks. Pero it's not going to happen in the near future here in our country. At binigyan na rin po tayo ng commitment ng local manufacturers industry dito po sa bansa, yung Philippine Chamber of Pharmaceutical Industries, na sinasabi nila that we have enough raw materials for us to produce more for the coming months for paracetamol.
Thank you po, Yusek. From Mark Fetaco, ano daw po ang nangyayari sa testing capacity ng bansa? Kasunod po ito ng inulat ng DOH noong nakaraang 2 araw na nasa higit 33,000 and 38,000 lang ang bilang ng mga na-test. Mas mababa kumpara sa karaniwang higit 50,000 tests per day. Malayo din daw po ito sa 100 tests na meron na daw po dapat ngayon. Ano po ang masasabi ng DOH and ano po ang mga hakbang na ginagawa natin para pagpalakasin pa ang testing capacity lalo na po sa hinaharap nating Delta variant?
Yes, no? So I think ang na-capture nyo lang yung ating generated results nung Sunday, August 8. That was 37,000. Pero bukod po doon, pag tinignan natin yung ating weekly capacity for this past 7 days, noon pong August, for the past 7 days prior to that. So nag-average po tayo ng around mga 50 to 60,000 tests per day. So pag linggo po, we expect that because every Sunday nagkakaroon ng non-operational laboratories because of maintenance and disinfecting procedures na ginagawa ng ating mga laboratorio. So expectedly, ang output natin pag linggo medyo mababa. Pero pag tinignan po natin pag weekdays, we are averaging 50 to 60,000. And yes, we are cognizant of that fact na medyo mababa pa ho compared dun sa target na 80 to 90,000. At tayo po ay nagra-ramp up ngayon we are distributing testing kits, especially to high burdened areas. And now we are using other methods like rapid antigen test kits para po magamit natin dun po sa mga outbreak areas natin.
Thank you po, Yusek. From Sheila Crisostomo, ano po ang benefits or indemnity na makukuha ng family if a vaccinated individual is proven to have died because of the vaccine?
Well, lumabas na po yung circular, and this is from the Philippine Health Insurance Corporation. Sinabi po dyan ng applicable package po for hospitalization due to serious adverse events. Ito ba yun? Sa immunization ba, Lindsay, or sa COVID-19 deaths?
For vaccines, because of vaccines use.
So hospitalization due to serious adverse events following immunization, makakakuha sila maximum of 100,000. Kung death naman po or permanent disability due to serious adverse events following immunization, they will get a lump sum of 100,000. So that is included in the PhilHealth circular.
Thank you very much po, ma'am. Yusek, kamusta na daw po yung healthcare utilization natin sa NCR, if you have the data now, ma'am?
Well, healthcare utilization sa NCR, nakita po natin na sa Districts 2 and 4, that District 2 would include Quezon City, Taguig, Pateros, Marikina, and there's another one. And then District 4, yun pong sa south po natin, mga Las Piñas. Sila pong dalawang districts na ito ang nasa high risk levels po natin. And what we are trying to do right now is establishing our networks para nakakaroon through the One Hospital Command so that we can better navigate our patients. Nakapagbukas din po tayo sa lung center nung isang araw ng ating modular. Atin pong pinag-iibayuhan pa rin na mag-expand pa ng mga beds sa iba't ibang ospital natin. When we look at our data, makikita natin na major hospitals natin are getting full. Pero tinitignan po natin yung posibilidad na makita pa rin natin yung mga ospital na lower level facilities na magagamit pa ho natin for step-down care and even maybe expansion.
Thank you po, Yusek. From Jessel, US FDA authorized additional vaccine dose or third shot for certain immunocompromised individuals. Posible po ba itong i-consider dito sa bansa?
Bukas naman lagi ang ating gobyerno, lalong-lalo na kapag nanggagaling sa credible institutions across the globe. Kaya lang, katulad nga ng sabi natin, kailangan nating pag-aralan kasi yung pinag-aaralan nilang mga bakuna dun sa kanilang bansa, iba po yung sa atin. Mas maraming ginamit sa atin na Sinovac and other vaccines that we have right now. So kailangan po natin talaga maging mapanuri. Kailangan natin maging maayos ang pag-evaluate para maging ligtas itong booster dosing sa ating mga kababayan. But definitely, the government is open for that. Pinag-aaralan lamang po. And pangalawa, gusto lamang po natin na at least we can be able to vaccinate as much of the population during this Delta variant spread of transmission para po tayo ay mas maraming mga kababayan na mapaprotektahan because of this increase in cases. So yan po yung equity component natin at atin pong pag-aaralan yan. Patuloy natin pag-aaralan so that we can be able to give recommendations for the public in the coming months.
Thank you po, Yusek. Yusek, if you also have the data now, magkano daw po ang initial budget for the proposed Philippine CDC?
Wala pa akong datos nito, kung magkano yung pinopropose na budget. Pinag-uusapan, meron kasing mga binago pa rin dun sa mga proposals.
Thank you po, Yusek. Ma'am, kamusta na daw po yung ginagawang phylogenomic analysis of the PGC? So, given na increasing po yung data cases na nakikita natin based on genomic sequencing, is the country already seeing community transmission of the Delta variant?
Hindi pa ho nakakapaglabas dito sa huling run ng phylogenetic analysis ang Philippine Genome Center. But based on the last run, yung August 5, nakakakita pa rin tayo ng linkage across these different individuals. Pero kailangan natin tandaan, katulad nga ng sabi ni Yusek Eric kanina, na ang ating mga samples are purposive sampling. We cannot test everybody. So it might not be representative. These samples might not be representative for us to conclude na tama na itong phylogenetic analysis will tell us if there's community transmission or not. What would be most important for all of us right now, we act as if there is community transmission already.
Thank you very much, Yusek. I guess that's all the questions that we can accommodate for now. And before we officially end our media forum, do you have any other messages po sa ating public and of course to our media partners?
Yes, unang-una gusto po natin magpasalamat kay Yusek Eric Domingo, our Director General from the Food and Drug Administration, para po sa updates na naibigay niya sa ating public and the media partners. Pangalawa, gusto po namin magpasalamat sa inyong lahat ng mga media partners natin dahil alam po namin, katulong po namin kayo sa pagpapakalap ng tamang impormasyon para po sa ating mga kababayan. So ang pagtaas at pagbaba po ng mga kaso sa ating bansa ay magdedepende po sa aksyon ng ating mga kababayan and of course, aksyon ng gobyerno. Kung tayo po lahat, makakasunod tayo sa minimum public health standards at ang gobyerno naman ay maitataas ang antas ng ating pagre-responde, atin pong makikita that we can surpass ito pong nangyayari sa atin ngayon, katulad po ng mga ibang pagtaas ng kaso ng mga nakaraang buwan dito sa ating bansa. Nais po naming bigyang diin ang ating mga responsibilidad bilang lingkod bayan at bilang Pilipino. Lagi po natin tatandaan, may magagawa po tayo. We are not defenseless. Napaka-simple ng ating magagawa, pero napaka-importante. Yun pong simpleng pagsuot ng mask, yun pong simpleng pagsuot ng face shield, simpleng pag-physical distance, simpleng pagpunta sa lugar na hindi matao, o sinisigurado na merong well ventilation or adequate ventilation sa pinupuntahan natin at palagi ang pag-uugas ng kamay. Simple rin po yung magpabakuna tayo kapag oras na at nakaschedule na po tayo. These are all simple things that we can do not only for ourselves but also for your families, for your loved ones, for your neighbors, for the whole community, and for the entire Filipino nation. So sana po sa panahon ngayon, magsama-sama tayo, magtulong-tulong po tayo. Tulungan niyo po kami dito sa gobyerno para po tayo lahat ay makalagpas dito po sa hamon na ito na hinaharap po natin ngayon. Maraming salamat sa inyong lahat and thank you very much, Lindsay.